Hi, I'm Ellen, and welcome to Mentally Detoured. Part 2 of a very condensed history of mental disorders continues, covering the 16th century until Freud comes on the scene in 1888. Before the 1500s, those deemed insane were kept in workhouses, poorhouses, and jails. Small private asylums had begun to be established, but as the population was increasing, the asylums expanded to house 100 to 500 inmates, as they were called. These were not places to treat mental illness, but rather warehouses to lift the burden of care off of the families and also to help eliminate disturbances in the towns. As such, those running the asylums were not trained, professional, qualified caretakers. The insane were still sentenced to lives of cruel and inhumane treatment, and in some cases put on display as public entertainment. Nice! The staff, if they were inclined to try and cure an inmate, would use the methods that I mentioned in part 1, the purging, the bloodletting, and the torture. There was a belief that one could choose rationality over insanity, and they believed that the cruel abuse would help them choose. By the late 1700s, the tail end of the Age of Enlightenment, conditions began to improve. In 1792, in Paris, medic Philippe Pinel took over the asylum there to test his hypothesis that patients would improve if treated with kindness. In 1796, English Quaker William Tuke established the York Retreat in York, England, where it was stressed that all should be treated with compassion and respect. This moral management movement also caught on in the United States by the early 1800s, and patients were encouraged to work at manual labor and participate in spiritual discussions. Unfortunately, moral management failed to continue for a number of reasons, an important one being industrialization of society and population growth. This became a time of massive expansion of the asylums that were already overburdened with large populations of mentally ill people. The good news is that while moral management failed, improvements of asylums and asylum care still continued in America and Europe. In 1845, the Lunacy Act was passed in England and Wales, where it effectively changed the status of the insane from inmates to patients, required asylums to have written regulations, and also required a resident qualified physician. Around the same time, an American, Dorothea Dix, became involved as an activist for the mentally indigent after a visit to England, where she met the Quakers and others in their circle who were active in the reform movement there. She returned to America in 1841 and began investigating asylums for the insane poor, first in Massachusetts, and then continuing across the United States, reforming asylums by working with state legislatures and raising money. This period of time was also when biomedical advances were being made in all areas of medicine. Classifications and diagnostic terms took on a more anatomical, clinical, descriptive approach. The belief that medicine was a cure-all for mental disorders was becoming more widespread. And now it's trivia time. Before they were called psychiatrists, asylum superintendents, not medically trained caretakers, were called alienists because they were thought to deal with people that were alienated from society. The term psychiatry was coined in 1808. Another bit of trivia, by the 1870s, lunatic asylums were named insane asylums. And finally, the word Bedlam. Bedlam became the nickname for the Priory of St. Mary of Bethlehem because of the conditions at the asylum, which was founded in 1247. By the 1500s, the word Bedlam entered everyday use with its current definition, a scene of madness and chaos, as in the scene on the football field after Ole Miss beat Alabama in 2014 was Bedlam. In part 3 of this history of mental disorders, I'll start with the end of the 1800s, where we'll first meet Sigmund Freud. Let's be informed and not walk blindly down the path of life. Until next time.